health can affect every area of our lives. Taking care of our emotional, psychological, and social well being is a must if we're going to be our best selves while pursuing our professional and personal goals. Welcome to the Creative Monday Discussion Show. I'm your host, Mervin Budram, and we are creatives transforming lives. Welcome back to the Creative Monday Discussion Show. I'm your host, Mervin Budram, and I will be with you for the next hour. Another Monday, another week, another Creative Monday Discussion Show. I'm really excited. I'm pumped for this episode. As I mentioned last week, this month we're in November, so I want to say hello, welcome November. We want to embrace and jump into this month very strong. As I said, this month we're focusing a lot about our mental health, our growth mindset, even as we're pursuing our business and developing our ventures, developing our business. We want to look at what's going on in our minds, what's going on here in our heart. So this month we'll be bringing on several guests to talk about that. So I'm very excited about tonight's guest episode, what we'll be talking about. But before we jump into that, I want to welcome you guys again to the show. For those who are tuned in earlier, it's always a pleasure having you guys with us. Thank you for tuning in. Invite your friends to come and tune in. Share the link, share the comments, share your thoughts, share your feedback. This is a discussion and we want to hear from you. So use the comment section to contribute to the conversation. If you have a question, if you want to have share your thoughts, use the comment section if you're on Facebook or if you're on YouTube. We want to say for those who are new to the Creative Monday Discussion Show, I want to first say welcome again. And I want to let you know that this is an entrepreneurial podcast, a live show that offers personal, practical business growth and life lessons from inspirational people from around the world who have experiential authority. And I say that because these are people, these are guests that are doing it, they've lived it, they've walked it out, and they're willing to share that with you. We want to welcome those who are tuning in on TNC. Thank you guys for watching. And again, if you want to be a part of the conversation, send us a WhatsApp message to 501-623-7898, and we will get your messages here on the show. We want to welcome those watching on Caribbean Vest TV in Europe, as well as those watching the reruns on So Arise TV in Antigua and Barbuda. It's our aim to have a weekly discussion that will inspire, motivate, and transform your lives. And guys, if you've missed any episode, any of our past episodes, we archive them all on our website, www.creativemondayshow.com. You can find all our past episodes and stay up to date with what's going on. And if you're a podcaster like me, I love to, when I'm doing my exercise in the morning, doing my morning routine, I'm listening to a podcast. If you are a podcaster like me, we are also on podcasts, on Apple Podcasts, on Spotify, as well as Google Play. Look for the Creative Monday Discussion Show. Follow, like us, and stay in the loop of what's going on. This episode is brought to you by MyTV by NextGen, the official streaming platform of the national channel and the Creative Monday Discussion Show.
The TV you love is always with you, from live TV, sports, and on-demand titles. Choose your plan today. Plans start as low as $15 per month. My TV, entertainment, anytime, anywhere.
Awesome, welcome back again. And I'm still not seeing where you guys are tuned in from. So I want to know where in the world you're tuned in from. So use the comment section. Let us know if you're here in Belize. Let us know if you're abroad. Let us know what part of the world you're tuned in from. And we will definitely give you a shout out on that note. Before we move on to bring our guests on, we want to take this moment to do our one-on-one segment. And for those who are familiar with that, we take a topic every month and we focus on that topic. In October, we were focusing on accounting, and now we're focusing on sales and marketing for our business. And we have a question that came in from Ms. Charlotte Lopez, and she was asking, can marketing be both cheap and effective? Great question. What we're going to do, we're going to head over to our one-on-one. Ms. Debbie Jolie, our expert for this month, who will give her insight on that question.
I love this question because, all right, so persons say cheaper. And the first thing I want to say is that marketing activities are both free and paid. So you can do online types of advertising, you could do email marketing, you could do content creation, you can do paid ads, you can do, you could have salespersons. The range of marketing activities are just enormous. So you can do almost anything. I think what persons have to understand is that where are your budgetary requirements, or where is your budget? Because if you're a new entrepreneur, you're a solo entrepreneur, there are lots of marketing activities that you can do for free. So putting out content every day, that's free. Doing an email campaign once a month, that's free. All you have to know is that you are, every time you do something for free, you are balancing that against your time, because there's an opportunity cost there. So as you put out content, of course, you're trading that with your time. Email marketing the same way. So there are options that are free, but I think as you begin to scale, we need to be a little more strategic in terms of what we want to get, the type of visibility and sales, and we will then have to sort of employ paid forms of advertising and marketing.
Thank you, Ms. Debbie, for sharing that. Thank you, Ms. Shirley, for that question. Very great question. We want to say good night to Charisse. Is it Charisse Ferguson, tuned in from Belize City? I thank you for tuning in tonight. Again, we want to hear from others. We want to know where you guys are tuned in from for the show. I want to jump in. I shared this last week. I tend to get really excited about these shows. This is my passion. This is something that's dear to my heart, building a healthy business community. And I tend to get excited like my daughter. So I kind of always have to kind of calm down. So I'm doing that right now, calming down before we bring our guests in, because there's so much in this topic that's dear to me. It's something that I've been recently just working on, as a leader in my company, as a business owner, as an entrepreneur. We're actually celebrating 15 years of being in business for my company TAS. And, over the years, it's been interesting, just the different things that we've had to go through as an owner in the company. And prioritizing our mental health is such a real reality. It's something that we don't talk a lot about in our space in the Caribbean. And so for us to have that discussion tonight, I'm very excited and looking forward to it. So I want to take this opportunity to introduce our guest for tonight. She is a Healthcare Program Navigator. She has obtained academics and professional qualifications from Bachelor of Medicine and Surgery to Masters in Healthcare Management. She currently works through the arms of a family healthcare center group in Florida and is focused on building partnerships with community-based organizations to help reduce identifiable gaps in healthcare access for vulnerable groups. Here to share her experience on prioritizing mental health, please welcome to the screen, born and raised Belizean Dr. Maurilee Young. Good evening, Dr. Maurilee. How are you doing this evening?
Thank you. Thank you so much, Mervin, for having me. It's such a pleasure to be here. I'm pretty excited and very proud of your production.
Thank you.
It only speaks volumes, not only now, but I've had so many feedback just even before this podcast. So I'm really excited to be here. Thank you so much for having me.
Well, thank you for those kind words. That means a lot. And I'm very, part of our desire is to create content that will inspire, motivate, and transform lives, and also build a healthy business community. And so, a lot of these discussions, it's our hope that those who are tuned in can walk away with nuggets, walk away with tips, walk away with inspiration, right? And just from we reconnected early in October on the Belize Investment Forum in Miami, and I was like, whoa. We stood out there. We were just having this long conversation around the same topic, and I was like, I gotta get you on the show for us to continue that discussion, because, as I said earlier, it's not something that we're talking a lot about. It's not something that, especially in the Caribbean region, there's not enough discussion and resource for this, but it needs to happen, because more and more, I believe that people are struggling, and we want to make sure that we provide some resource. So even before we continue, I just want to say good night to Steve Moody. He's logged in from New York. So good night, Steve. It's good to have you with us tonight. So Dr. Young, what do you prefer, Dr. Young, Dr. Maurilee? Like,
I'm not a white coat type of person.
Awesome.
Even with patients, I just call me Maurilee.
Maurilee.
And I'm definitely off duty at this point in time. So
very good. Awesome.
Maurilee is fine.
Awesome. Well, just a little backdrop. We actually went to school together. We went to SJC together. That was years back. I won't say how long back, but we went to school together. So
I'm not afraid of my age.
Well, it was interesting to reconnect and see where everyone ended up, after college and what happened, right? And so talk to us a little bit about your journey, your background, kind of how did you end up in the current space that you're in?
Well, I mean, I could go as far back as childhood, but I won't bore you guys with that. I remember just briefly talking to my parents and trying to figure out what I wanted to do. I come from a family that was legally inclined. And I remember asking my dad, how many people want to, kill you or sue you? And he's like, only about 10. I said, okay, well, not for me. But I've always had a caring disposition and a community-based experience growing up with my family. So naturally, I was driven towards healthcare or some kind of care providing profession. So I found myself quite humbly and appreciatively in the industry of healthcare, and I have no regrets. I love it very much, even though it's absolutely demanding, but and a rewarding profession would be, right? Yeah. But I'll just give a little background as well. I'm an alumni of St. Catherine Academy.
Yeah.
However, I'm pretty sure I was an honorary friend of all the other schools, Wesley College, Paloti.
Yeah.
I played basketball, so I had a lot of friends outside of St. Catherine's. And I was very competitive, not good, but willing.
Some competitiveness is good, it keeps us on our toes and it pushes us higher.
I knew how to lose with grace, and I knew how to align myself with the winners when we did win. So, but yes, I enjoyed my high school years very much. After that, I went to St. John's Junior College, where I attained an associate's degree in science in biology and chemistry. I went on to achieve a bachelor's in psychology, which afforded me the experience to do a little bit of counseling with kids in vulnerable areas here in Florida. And then I embarked on the journey of pursuing medicine. I went to Jamaica, where I attained a Bachelor of Medicine and Surgery, and thereafter practiced in the public sector for a very short time in the private sector as well, in community health, internal medicine, and nephrology. Shortly after practicing, I always had a plan I never wanted to stay in clinical medicine for the entire projection of my career. Always wanted to retire from clinical medicine into public health. I thought I would have gifted myself that when I turned 40. I am a few years short of that, and I decided to jump the gun and just go right into a master's in healthcare management and hopefully a PhD. But I am who I am rather than what I do.
Yeah.
So I try to remain, myself to the core, irregardless of what your credentials are. I'm currently a healthcare program navigator, as you mentioned, with a federally qualified healthcare organization, a conglomerate of healthcare centers, which is focused on identifying those groups who display or are at risk of disparities within health access and services. So, yes, I am a Belizean living abroad. However, I take Belize with me everywhere I go. Everyone knows that I'm from Belize and not from wherever I am at the time. And in addition to living in Florida, I've lived in Jamaica for a few years. So, yeah.
Very nice. The part of healthcare, being a doctor, that journey is one that's at least I haven't personally gone through it. I almost did. My mom wanted me to be a doctor.
Yes.
It was actually at SJC that I realized that was not the direction for me. I think we were in biology class,
Yes.
math class, and after the first year, I was like, this is definitely not my path. Not because of the workload, but just the reality. Like I cannot handle blood. I can't handle that kind of,
Yeah.
But that part it's grueling. It takes a toll. It really works on your time. Like you got to put in lots of hours, lots of study, lots of research, a lot of self-sacrifice. Talk to us a little bit of what that looked like for you. What was those years like for you as you were going about going after this goal that you had?
Well, even if I didn't have any kind of self-drive, I didn't have a choice. Whatever we were set out to pursue, we couldn't come back home without completing it. I remember mentioning to my parents that I wanted to go to Jamaica for several reasons. I was already in my bachelor's here in Florida. I left Florida to go to Jamaica. And my mother wanted to die. She
Wow.
what are you going to do in Jamaica? How are you going to survive? But there was no choice but to survive and to manage the balance that is necessary to be successful. I wasn't initially great at being a medical student, but I had to learn quickly what it is that I needed to adopt in order to be successful. I'm a type of learner that likes to assimilate things on my own first, but with the volume of work that I was encountering, I knew that I needed to depend on a team. So I found myself with 6 people and I bargained with them. So I thought, okay, if we have 20 chapters to cover, I first of all remembered the sacrifices that got me there. There was no wasting my parents' investment, wasting my time, or representing my country. So I bargained with these students that if you come over my house, I'll cook for you. And we can all teach each other a topic. If we did not have the time, or if somebody had some personal issue going on, we covered the material for them, gave them the notes that they needed in order for all of us to be successful. So if it's anything that I learned how to, 1, ask for help, 2, acknowledge that I don't and can't do everything, despite the task at hand, and also to persevere. Sometimes it required taking breaks. which I still practice now for my own endurance. But yes, I was the president of the Student Exchange Association in the Medical Student Association at school. And we had a lot of people suffering from depression, suicidal ideations, believe it or not, even in their professional pursuit. So it made me realize that as humbling as the experience was being away from home and not having support myself, other than the support I created for myself, because I had no family in Jamaica, I had to be strong, but also acknowledge when I needed help.
Yeah.
And not rely on my own understanding. And this might not be for everyone, but I relied on my faith as well.
Yeah.
When strong people can be weak. So you just had to, not think of yourself as your only source.
Yeah.
I think there's a reason why we are in community, regardless of what industry or what arena we find ourselves in. So that's how I got through.
Man, that's amazing. That's amazing. And I'm taking some notes here because we have people watching that are in the medical field, some watching in different fields, some are business owners, entrepreneurs, startups. So how does this apply to us? And what I wrote down from what you were saying, this is what I'm extracting. One, you got to find your community. And I love what you did. Like, you created the environment for your community to come to you. I love that. Like, I'm going to cook for you if you come over. You created an environment for your community to find you. And I think that's so key. Are we creating an environment around us that will be a magnetism to our community? Because we need help. And I love that you said that, acknowledge that you need help and ask for help. So that's another point, the willingness to ask for help. And then when the help comes, to receive that help. Yes. And to also be a help. So I have here collaboration. And then I love what you said as well, to persevere, create a support around you, right? So I'm just reiterating what you're saying because I feel like it's important for people to understand, regardless of whatever pursuits we go after, these are key ingredients for us to have success. These are key ingredients for us to kind of make it through. So is there any other lessons you would say, like maybe if you had to add any additional lessons you've learned from that season of your life that you would want to share with our audience tonight?
Yes, absolutely. So in addition to self-care and persevering, or having a mind frame that, you no matter what, you have to try and be successful, I maintained healthy relationships around me. And I'm talking about friendships, colleagues, personal or intimate relationships. And I learned how to let go as best as I could. That wasn't always easy, but every skill requires practice. And, I planned ahead for financial concerns. I was a student outside of my comfort zone. And so I had to plan my life in 6-month spans. It never always went the way how I planned, but at least I had a plan A or a plan B, and, reaching out to my support if I really needed to. I also, though, even though my purpose, passion, and journey was in healthcare, I have been exposed to the business of professional services. Yeah. So raised up in the business of the law firm rather than the legal services of my dad's law firm long time ago. I come from a mother who started from scratch her own business. And we, by default, me and my siblings, continued that business even in the midst of our professional pursuit. Wow. So I, by default, rather than actively pursuing the principles and the lessons in business, I was exposed to that. So it was, I think sometimes we have to listen to ourselves.
Yeah.
And we have to go with a leap of faith sometimes. Of course, with planning, and being, sensible. But I decided to merge my passion for healthcare as well as my exposure and experience in, family business. And that's how I ended up in healthcare management, and loved it instead of just public health. I'm still in a little bit of public health, but I would say all along the way, in your academic and professional pursuits, as well as your performance in the workplace, take those same principles with you.
Yeah.
I think that a lot of times in the workplace, there's a lot of like ineffective communication. And I'm saying this because I experienced this in the business of healthcare as well.
Yeah.
There is a heavy workload a lot of times. Maybe that might vary or it might be seasonal. There are personal stresses or stressors that each individual employee comes to work with. And we have to be mindful of that instead of snapping back at people when they're having a bad day. I currently work in a company, and I hope that I chose the company as much as the company chose me, because the focus is highly on that work-life balance, and not just the life balance, but the work balance as well. Learning how to cope with your workload and your coworkers, as well as achieving the tasks at hand. And that can only be successful by communicating properly with your employee, or your employer-employee communication, or your employee clients, or your employee patients relationships or communication. I think that's essential in having a successful environment, a healthy work environment, irregardless if it's marketing, business, healthcare. I think the principles remain the same. And for us, we were sleep deprived, which was not healthy, but we had to find ways around that. I remember working for an attending or a consultant who was like, I know we had to operate on 4 hours of sleep, but let Maurilee go home and spend some time with her family. I didn't have family there, but spend some time with herself so that she can be valuable to the team. And I really, really cherished that. Despite our conditions, I did not work in any great conditions. I would have to admit that. I came from the comfort of sleeping on a wonderful bed to sleeping on cots sometimes, or not sleeping at all. But despite the workload and sometimes the unacceptable conditions, you kind of have to remember why you're there. If you're working at the bank, or you're working in a small business, or you're working in a hospital, or whatever, you have to remember your purpose and kind of, try to manage your stressors and your emotion. And by doing that, you have to take breaks. And communicate when you need that break, or communicate when you need help from your team. So I think that's essential.
I think that's really key. And a lot of what you're saying and sharing are very key principles there. And I want to say, for those who are with us, guys, like, many times things are caught, not taught. And so even as Maurilee's sharing, like, listen to those little nuggets. Like, I'm writing down some nuggets here. For myself as well, because we're never too old. We're never in a place where we will never stop learning. So we want to keep looking for those opportunities for us to learn. Maurilee, a question came in from Nicolene Christina. Can we get that question up? It says, at what point should someone consider seeking professional help for things they can't figure out?
Well, I think I'm gonna use this opportunity to give some recommendations. I'm not a mental health expert. As I mentioned, I was in internal medicine, but I invited a colleague of mine who I think is a very intuitive psychiatrist. We graduated together, but she has a really good repertoire. This is Dr. K.O. Ford. And I asked her, well, since she couldn't make it to this podcast tonight, what would be your recommendations as a professional? And I think she gave some great tips, which I will share with you. So there's a huge scope of mental health conditions or stressors, anxiety. At which point do we seek medical help? Well, it depends on your functionality. If you are dysfunctional in any areas of your life, or you're having a reduction in your quality of life, you're not able to perform at work, or you're not able to function at home, or you're having suicidal ideations is just automatic, even if you think that you would not do anything, you would not actually have actions of suicide. But if you're having ideations or thoughts of it, I think that warrants seeking help. I do think that there is a point at which you can seek help before you have any critical or acute symptoms of psychiatric conditions, rather than just psychological disorders. But it starts with identifying that we might not be coping well, or might be functioning in all areas of our lives. But the recommendations from Dr. Ford includes talking to a close friend that you can trust. I know that's difficult sometimes, but don't be afraid to speak with a relative or a close friend. Stay connected socially with the people around you, even if you don't tell them everything that's going on with you, or if you are not coping. And physical things, healthy behaviors such as eating or having a balanced diet, exercising and remaining active, despite how fatigued we might be or overwhelmed. Have positive affirmations, if not prayer, for those who believe in prayers. Have some quiet time if you need to. Personally, I gave myself, despite the fact that I was very, very busy, I gave myself 24 hours every week for years, literally. And it didn't have to be an entire day. It could have been Friday evening, because I had to work Friday during the day.
Yeah.
And 24 hours into Saturday, and I go back to work on Saturday evening. So for me, that was the way how I endured. Sometimes taking breaks from all the influx of information, even if it's just the news or social media. Sometimes we need a break from, the input of, things that kind of boggle our minds. We also want to follow credible sources. We don't want to fill up our minds with information that just scares us unnecessarily. Finally, she suggests ask for help. And that can be from a counselor. It can be from a friend. It can be from a pastor. It can be from a psychologist or a psychiatrist. I know a lot of times the latter help in the form of a psychologist or psychiatrist might be constrained or limited by affordability. But a lot of times seeking out a friend or a counselor or a pastor sometimes might be enough. And if not enough, then it would be really important to know what those resources are in your country, particularly Belize. So yes, anything that indicates, or any symptoms that indicate that you're not functioning well in your areas of life, professionally or at home or in your relationships, I do believe warrants seeking help in any one of those forms.
This is really good stuff, guys. And welcome, Barrington, a good friend of mine. He's been a guest in past episodes, and he's saying good response, Dr. Young. As a psychiatrist myself, I find those points excellent. I even apply some of those you mentioned for my own mental health in order to remain effective in helping my clients. And it's true, it's true. Like I've found, like for me, We're doing a lot. We're running business. We have our family, especially in
Right,
this
right.
COVID time. Now the kids are home. You're doing school virtual. Like everything is starting to kind of overlap some, and it's important to find those coping mechanisms. You said it earlier, like the coping mechanism, and I was writing them down because it's sometimes our tendency. At least I'll speak for myself. My tendency and my personality, I tend to just slug it through and just keep going and keep going and keep going and fail to recognize like the
Burnout.
dynamics have changed and I'm burning out, right? And so just the ability to talk to a close friend. Sometimes we can go. I have one of my really good friend, and it dawned on me the other day. Like 2 months or 3 months have passed, and we haven't talked because both of us have been busy running business and doing all these things. So it's important to take those moments to talk to someone, stay connected socially, having a balanced diet, exercising, positive affirmation, very good points and principle. And I agree with Barrington that these are things that we can use, especially now in this current pandemic climate that we're in. A lot more people are stressed, a lot more people are anxious, a lot more people have a heavy workload, family load overlapping, right? And so it's so key to be able to find these resources and tools. Dr. Young, Maurilee, I'm thinking like what, I said it earlier, like, a lot of, I can only speak for our area, but a lot of in the Caribbean, we don't want to talk about these kind of things. Mental health, it's like a taboo conversation to have. Why would you say this kind of conversation is important? A conversation to have, especially in the workplace and in our homes and family and everything.
You know what? I'm really saddened by the fact that we're still in a time where there is stigma surrounded on mental health. I think there is a lot more highlights or attention or focus on mental health in our current times. But you're right, there's still a stigma, there's a fear on mental health. A lot of people probably think that if you seek out help,
something's wrong,
we're weak or we're crazy, or we don't want to be labeled with these titles. And it's so far from the truth. No one is immune from this because we're all human, right? And we are performing roles, and those roles can change, or the conditions through which we're performing those roles can change. But you brought up a great area or influence of COVID has on mental health due to the frequent lockdowns, the isolation. These have multifactorial adverse effects on both your physical well-being as well as your mental well-being. We all know that it has had an impact on education, on social interaction, on our economic productivity, because it disrupts our routine life. However, I spoke to the director of BFLA, and just to see what are the more common mental health burdens that have been present in Belize, especially since COVID. And there's a lot of panic, PTSD, believe it or not, postpartum depression, and depressive symptoms in general. And I'm unclear, really. Maybe Dr. Friesen can speak more about this, but it's really good to let the community know what are the resources that are available, even if it's not to see a psychiatrist or a psychologist, and how can people access those resources. Those who tend to have good social support or maybe economic stability tend to do better, fortunately and unfortunately. But here we have the gaps and the
Yeah.
social inequity. So I really do think that it's important to let everyone know how to access these resources. And it can't just be about health. It can't be health professionals. It has to be a community effort.
Yeah.
It has to be the politicians or the government officials, if not the politicians, as well as the healthcare community, as well as the schools,
Yeah.
and employers, believe it or not. Employers need to recognize that they have human employees
Yeah.
working in their businesses. So adopting a team approach, or screening persons, or having some kind of access to counseling or coping with anything. A lot of people have gone through loss of loved ones, grief,
Yeah.
and are going through those stages and still having to provide for their families.
Yeah.
So it's really important for us to identify, not just to identify those symptoms or to identify those the behaviors or the dysfunction in the workplace and in your personal lives, but to have those resources and to access them. So it's really important. COVID brings a whole different impact or paradigm to
Yeah.
mental health, but it doesn't mean that we can't do something about it.
Exactly. And the reality is, a lot of people will fall and has fallen through the cracks.
Yeah.
Like we're not even getting the full update on what's really going on the ground with some of the realities of
Right.
what people are dealing with. It's scary to even begin to think about. And so I agree with you more. The community, everyone needs to play our part in seeing how we can alleviate, how we can support, how we can help where we can help. Even in the workspace, to have an environment where our employees, our team members can come and say, hey, this is what I'm going through. And then even as a leader of the team, to be aware and to take note of when someone's countenance is changed, when they're, sometimes the work level dropped, and rather than attacking, to kind of like, okay, I know this person is this type of performer in the work, so something must be going on, and to kind of inquire and help them open up and help them process what they're going through, right? So
Absolutely.
all of us need to step up in this time like never before.
Yes, absolutely.
Yeah. So what we want to do right now, and guys, I just want to again thank those who are tuned in and watching. If you have questions, if you have comments, if you have experiences that you want to share briefly on, just go ahead and use the comment section to send that in, and let us know. We want to hear from you as well. We want to hear your thoughts. Part of why we're having this discussion is because it's important. It is an important topic. It's even for me. Like I was telling Dr. Maurilee, like I coming into this year, I did counseling. I've never done paid counseling before, but the amount of stuff coming at me, the things I had to deal with, present, past, plus just the workload, I had to process some of those things. So I sought out some help to deal with that. And so I just want to encourage you guys, take action. Don't stay there in what you're going through. There's help available. We're going to bring on Dr. Lara Friesen. Dr. Lara is a medical doctor who graduated from the University of San Carlos of Guatemala. She works as a general practitioner at the primary care clinic here in Belize City. Well, in Belize City, I'm in Belmopan. And we're going to bring Dr. Lara, and what she's going to talk about is what are some of the resources that we have available here in Belize that she's aware of, and she's going to share a little bit of that with us. So if we can bring Dr. Lara on to the screen, we're going to talk with her. Good evening, Lara. How are you?
Hi, good evening. I'm doing well, thank you. It's nice to be here tonight.
It's definitely a pleasure to have you. Thank you for jumping on. This was short notice. Just let me give you the quick backdrop. I reached out to Lara last night. She's a good friend of mine, our family. So I was like, Lara, we're having this topic. talk to me. What are some of the resources? And she started telling me. We're on a phone call, and she's telling me, and I'm like, okay, this is a lot. I will not retain all of this. Can you just come and tell our audience about this? And she said yes, and so I really appreciate that. And so Laura, let's start with that. Tell us what from your experience and what you're aware of. What are some of the resources here in Belize when it comes to this topic of mental health?
So let me start off with saying that I'm glad that Dr. Young was here today, because it actually highlights a big need that we have in Belize for better healthcare navigation. A lot of times a problem that we face even as doctors in Belize is that we don't know what all resources there are, and we have difficulty referring our patients to the right resources. And so this is a big gap in Belize. So I'll just quickly mention some of the things that I know exist in Belize. So we do have a public healthcare system that does provide some level of mental healthcare resources. There is a total of about, if I'm not mistaken, around 12 PNP nurses, which are psychiatric nurse practitioners, that are stationed in Corozal, Orange Walk, Belmopan, Belize City, San Ignacio, Dangriga, and Punta Gorda. Most of them are located at the district hospitals. In the case of Belize City, they are located at the Port Loyola Clinic. These psychiatric nurse practitioners are available if you have any problems with anxiety, depression, suicidal ideation. They are available to provide consultation in the public sector. As well, in the public sector, we have one psychiatrist working in Belize City, and also we have several private psychiatrists working in Belize City. And then we have, through the public sector as well, we have the Employee Assistance Program that is run by the Ministry of, I want to say Human Services, but it's not the right ministry. Ministry of Public Service, I believe. The ministry's recently changed names, so sorry if I'm not sure about the ministry's name. Anyway, it's run by the government of Belize, and it's available for all persons that are employees of the public sector. So if you work in any sector of public, as a civil servant, in office, police officer, in any of the hospitals, you are able to that are free of cost through your supervisor through that facility wherever you're working. So that's a very great resource if you're working in the public sector. That's very easily available, and that is you can get referred to it quite easily. If you do have more resources, there are some private psychologists and private counselors that are also available for a fee in Belize. That there's a handful. I won't go ahead and name them, but if you do know you want to seek that service, you can just look up some or Google, or you will find that there are almost all of the cities have one or two counselors or psychologists that are working. So that is a basic backdrop. If we do, as an entry level, if you are part of a primary care clinic, for example, where I work, we have a population of around 10,000 patients that we take care of. And you can also go to your primary care provider, like your general practitioner, your family doctor, and mention to them what kind of issues you're having. And we can also provide basic guidance and refer you to someone else based on what your symptoms are having. But what kind of symptoms or what kind of functional problems you're having. I just wanted to mention one quick little thing. Maybe I'm stealing Dr. Young's show here, but I just wanted to mention one quick thing about professional life and burnout, mental health, and that's burnout. I found that for myself over the last year, it's been very helpful to be aware of what burnout is and how it affects me. And when I start to feel the symptoms coming on for me, it usually is a little bit of irritability, lack of energy, feeling like I don't want to see another patient. And when I feel those feelings coming on, if I take the moment to take a break, and maybe even take a day off if I have that available, or if not, take a weekend day and just try to decompress and try to, do something to let my mental health take a break. I find that's very helpful to be aware of that. And in the professional workforce, that's very important as well. And yes, I just noticed that there's other people commenting. There are a lot of resources available. We should really work on getting a better network available in Belize so that we have more reliable ways of referring persons who need assistance.
Well, thank you so much, Dr. Laura, for that insight. It was definitely helpful. And so comments are coming in, and since I have both of you on screen, I'm going to direct them to both of you, and you guys can give feedback on them. But this question came in from Melanie Escalante. How do we know when to seek help, intervention, and how do we know that it is more than a bad day, week, season for our lives, or family member, colleague, friends?
I'll let Dr. Friesen comment on that, and it's not my show. I'm so happy that you're here.
Well, let's see. Well, one thing that you mentioned, Dr. Young, was about the functionality. I think that is actually a very, very good point. If you notice that the function is slacking off, like someone used to be an agreeable person who everyone could get along with, all of a sudden is having constant outbursts of some kind. Just looking at the level of functionality, that is a very good way. Also, one very good way to know is just to ask. A lot of times we don't want to ask people if they're really okay, and if we do, then we don't wait to listen. And so I think that is one of the key things for family members and friends, is to ask them, how are you doing? You don't seem to be doing very well. Is there anything I can do to help? What do you need? What can I do to help you? Or do you want help? And a lot of times we shy away from these conversations from our kids. They're 3 years old and they're in my waiting room, and I hear the mom telling the kid, stop crying, stop crying, stop crying. Well, I mean, maybe there's a reason the kid is crying. I don't know. Maybe they were having a tantrum, but we just have this suppression of emotions that starts from a really young age. And many people need to learn to talk about their feelings. And so one way of knowing if a family member or someone needs help is to ask them, do you need help? And sometimes these persons are so far in feeling overwhelmed that you have to take them by the hand and say, yeah, you want help? Do you want me to make an appointment for you at the counselor? Do you want me to take you? Do you want me to ask you again if you want an appointment a week from now, if you don't want one now? We can take baby steps with them, and if we're willing and willing to serve and willing to step out of our own comfort zone, many times it's just ask them. Ask them what they need and ask them if they're okay. And that's the first step, I would say.
Thank you, Dr. Laura.
Mervin, I just want to add, and I think that's absolutely valuable information, but follow through.
Yes.
I think a lot of times when persons seek out help, and I'm guilty of that too, in my own family, I remember identifying certain dysfunctions, and I just didn't follow through. So as the person or the point of contact, just to have some kind of mechanism to follow up on that person, because it's already hard for them to reach out or to acknowledge that they are not coping, or they're not coping in whatever capacity. It's good to reassure them that, listen, we're not just giving you recommendations and letting you just go figure it out. We're also following through to see, did you seek out services? And if not, what was the issue, or how can I better help you actually get the help that you need? So it's really good for all persons, healthcare providers, as well as counselors, as well as school counselors, neighbors, family, friends, church pastors, just to follow up with that person that you have identified that needed help.
Very good. Really, really appreciate those input. And I think it's important, if I could add as well, creating an environment that's safe, creating an environment that celebrates when someone comes and opening up. Because I know for me, in some of my earlier years, there were some things I had to work through, and it's hard to come to someone and say, hey, there's this era of my life that I'm struggling with. it's hard. I'll be the first to say that's not an easy thing to do, but it's a brave thing to do. And one of the things that helped me was every time I came, it was my pastor at the time. Every time I came to him, he was like, "Man, I am so proud of you. I see you in such a huge way. Like my respect for you has gone up even more." And so that created an environment for me to feel safe and to overcome that fear, to open up and say, "Hey, this is what I'm struggling with." And so we have a responsibility as leaders, as friends, as family, as community to create that kind of environment around us. A question came in from, I think it's Carrie's Corner. I want to get that in. We have about 5 more minutes. So I want to get this in before we go. But it says, do you find that if the ego problems are addressed, the mental issues are easier to resolve? Any thoughts? I'm not sure what they mean by ego problem, but if you guys get what they're asking, please feel free.
Do you want to take that, Dr. Young?
Go ahead.
Okay. I'm just gonna give a brief overview. I am also not a mental health professional, but what I am reading into the question is that identity is a major issue when it comes to mental health, and I think that mental and spiritual and psychological health and emotional health are all very interrelated, and you cannot really deal with one without addressing all of them at some level. And so if there's ego issues, that to me sounds like issues of identity, issues of selfishness, issues of who am I really, or who do I really want to be. And those are important questions, and those are also questions that we can deal with on a mental health level, but also that's where spiritual support becomes important as well. If you're part of a spiritual community, if you're part of any kind of church or have any friends that support you in that way, it's important to discuss these things to realize what it is that you're really dealing with. But it's an integral approach. It's not, we can't deal with one problem. You can't say, oh, I have an ego problem, or I have this kind of problem, and I have depression. Usually those are all interrelated, and as we become healthier and we develop more healthy thought patterns and more healthy identity in who we are and who God created us to be, all our mental health should start to improve at some level or the other. We won't all be at the same level all the time, but we work on all the issues together as a holistic person. It's not, we can't pick apart a piece from the other. And so when we deal with mental health, we deal with everything. We deal with physical health, we deal with emotional, spiritual, psychological, social health. And so that it's a very big topic, and that's why it's important that we really are able to reach out and that we're able to support other people and support ourselves when we are dealing with some of these questions.
Absolutely. And I told you, Mervin, you would need multiple segments for a topic like
I know. This is like to do a part 2 of this.
It's very, very interesting and probably relatable to a lot of people. But I'll just quickly add that it's almost a nature versus nurture. There are environmental factors that might lead to the incidence of mental health disorder or condition, as well as a genetic predisposition sometimes, or a clinical predisposition to depression or anxiety, or even the psychotic disorders spectrum, irrespective of if it's environmental or genetic. I believe reducing the stigma will make it easier to not necessarily resolve, but to gain control of the condition in that individual. I believe that if it's easier for persons to seek help without being subject to being stigmatized, I think would really, really be valuable in, achieving a better outcome with regards to managing our mental health as a community. And that should be global, not just for Belize. I really, really find that when a person who is suffering from mental health, finds themselves in an environment where they're not stigmatized, they tend to have a better outcome, irrespective of the source, or whether ego is involved or environmental or otherwise.
Very good. Well, I hate to bring this discussion to a close, but we're out of time. We have 1 minute to the finishing up of the show. So I just want to thank both of you guys, Dr. Laura and Dr. Young, Maurilee, for coming in and just really giving your experience, giving your value, adding to what you know, and just really sharing that freely with our audience. I want to thank our audience for tuning in tonight, for always making this show your show. I want to thank my team, Ruth, Kimana, Joshua, and Shireen, who works behind the scenes to make the show happen every week. Thank you guys. Thanks to TNC, Caribbean Fest TV, and Sunrise TV for broadcasting the show. And I want to say God bless you. I will see you guys again next week, Monday. And remember to treat every day like it's a Monday. See you next week, Monday.